Good afternoon, everyone. Welcome to Friendship Public Charter Schools Parent University series. I am Charmaine Carter, the Director of Parent Relations here at Friendship Schools, and we're so glad that you can join us. Today, we are discussing adverse childhood experiences, also known as ACEs, and mental health, essentially how it affects your well-being. So if you know someone or if you have experienced childhood trauma, such as divorce, a death, dysfunction in the household, sexual or physical abuse, things such as that, please share this video and please join us. This is not limited to our friendship community. This is for anyone who could benefit from this information. And so if you have any questions after this presentation, please contact us at wecare@friendshipschools.org, or you can call our hotline at 202-281-1777. All right, let's go ahead and get started. Mr. V and Ms. Davis, you can take it away.
All right, good evening, fantastic friendship family. My name is Mr. V. My co-host this evening is Ms. Davis, and we would like to welcome you to our presentation on ACEs, otherwise known as Adverse Childhood Experiences. All right, we're going to give you quick introductions, just let you know a little bit about who we are. My name is Jim Volsky, but my kids and families who I work with know me as Mr. V, and I encourage you all to call me Mr. V as well. I was born and raised right here in Washington, D.C., and I actually went to high school down the road from Blow Pierce over in Brookland. I've been working in mental health since 2013, and I've been working back home here in D.C. since 2015, and I currently work at Friendship Blow Pierce.
Hi, good evening, Blow Pierce family and friends. My name is Jeanette Davis. I was born in Queens, New York. I grew up in Philadelphia, Pennsylvania. I attended Philadelphia, Pennsylvania City Public Schools. I worked with students in Maryland Public School System for 15 years. I currently work for Friendship Public Charter School as a professional school counselor and have since 2019. So, what are ACEs? ACEs refers to adverse childhood experiences. These experiences can have a significant effect on us and even influence how we feel and behave throughout our lives. Would you like to know your ACEs score? If so, you can access the questions through NPR or the CDC Center for Disease Control website. Here you can go through question by question and determine how many ACEs you have experienced. Due to the personal and difficult nature of the questions, we will not be going through the survey individually in this presentation. However, we will be talking about ACEs generally now. Triggering warning. Some of these items are difficult to talk about and relate to traumatic experiences. If you're concerned that they may affect you significantly, feel free to excuse yourself for the next few moments. We will also be available to chat after the presentation if anyone needs to process things. So, what are ACEs? Some examples of adverse childhood experiences include surviving physical or verbal abuse, being raised by caregivers who struggle with alcohol or drug abuse, having a family member who is incarcerated, feeling alone or unloved, not having enough to eat, witnessing violence, having parents who go through a divorce, having a family member with mental illness. Those are just some of those adverse childhood experiences that families experience as a young person. While that list is thorough, it isn't comprehensive. There are a wide variety of things that can be considered to be adverse childhood experiences. So if you would like more information, we encourage you to go to the CDC's website and read more. In an ideal world, no one would have to experience ACEs, but unfortunately, they are probably more common than you might think. How common are ACEs? Well, according to the Center for Disease Control, CDC, 61% of adults surveyed across 25 states reported that they had experienced at least one ACE. So if you have experienced any, you are not alone. The same study indicated that about 1 in 6 respondents had experienced 4 or more. There's a good chance that our kids may have already experienced one or multiple adverse childhood experiences. ACEs can have an effect on us even later in life. According to the CDC, adverse childhood experiences can increase risk of injury and even chronic diseases such as cancer, diabetes, and heart disease, in addition to putting us in increased risk for suicide. So a lot of these illnesses that we find out later in life might have contributed from having been exposed to some of those adverse childhood experiences. And so when we reach a certain age in life and we're being diagnosed with certain things, we wonder, how did we come to that point? So some of these studies have linked it to adverse childhood experiences. So long-term stress from adverse childhood experiences can even have an effect on brain development. Um, they can also affect things like attention, decision making, learning, and how we respond to stress. So, a lot of times, our children come to school and they seem to be a little overwhelmed, a little stressed. And so, some of these things are based on maybe some experiences that they have experienced in not only in the home, but outside of the home. Okay. What does trauma look like? In our kids, trauma might look like anger, it might look like irritability. They might have behavioral problems such as outbursts, being quiet or withdrawn, the exact opposite, isolation. In severe cases, they may report that they are seeing or hearing things that aren't there. What does trauma look like in adults? Well, adults' trauma might look like having overwhelming, unwanted thoughts or dreams about the event. You know, we might go back into the past and things might conjure up. And it's because of an event that might have happened and it was overwhelming. Feelings of sadness or depression. And that plays a big important role in as far as ACEs is concerned. Feelings of extreme anger, that's a big one. Having strong reactions that are disproportionate to the stimulus. Think of it like this, like little things setting you off in a big way. What have we learned so far? We, as well as our kids, may have been through adverse childhood experiences. It's not uncommon in many of our lives. There's just things that we just maybe may not have identified, but it was there. These experiences can potentially lead to behavioral, health, and mental health problems later in life and can affect brain development. So, what can we do? There's things that we can do. So, I have a 5-minute video that can give you some ideas of how we can help our families and help how we can get help in the community to try to reverse some of these adverse childhood experiences.
Can you see the video, Miss Davis?
Yes.
All right, great.
Hi, this is my neighborhood. I grew up in this building. This is a great community now, but it's had its share of problems. When I was a kid, our community had high unemployment, a lack of resources for families, and lots of kids hanging out with no adult supervision. You might have heard about adverse childhood experiences, or ACEs. ACEs are traumatic events in childhood, like abuse and neglect, that can increase risk for future problems. But they don't have to. The good news is that ACEs and their consequences can be prevented. Take me, for example. I was at risk for ACEs, and despite all the things that put me at risk, some pretty incredible people helped make sure that I wouldn't become another statistic. Come on, I'll show you around. That's Jackson. He's a cool kid. His dad left when he was 2, and his mom works 2 jobs. I hang out with him every Thursday night and help him with his homework. Sometimes we grab ice cream. It's fun. Plus, he has another adult role model to learn from and trust. That's Mr. Martino. When I was a kid, he let me help him at the store sometimes after school when my parents were working late. He did that for a bunch of us. My dad actually found his job as a mechanic because of Mr. Martino. This helped our family in so many ways. Not only did my dad have a steady paycheck, which eased his stress about paying rent and buying necessities like food and clothes, but he was also a lot nicer to me, my brother, and my mom once he started working a job that made him feel good about himself. When communities come together, they can do so much to prevent ACEs. Mr. Martino and other local business owners put together a series of career workshops to help people like my dad find work. My mom also got a job with a company that allowed her to work from home and spend more time with me and my brother. Mariana has just gotten out of a class about handling challenges of single parenting. The clinic offers free childcare so Mariana's daughter, Ella, can play while Mariana's in class. The class helps parents like Mariana develop positive parenting skills, not just for babies and toddlers, but for teenagers too. This is another way our community has come together to give families the resources they need, and just one more way to prevent ACEs. This was my school, Riverside Middle, right in the heart of town. These kids are here for a sponsored summer camp. This community-supported program helps families with affordable, quality childcare and helps kids get tutoring and learn life skills. When I was a kid, I spent a lot of time at this school all year long. There was one counselor, Miss Greer, who I remember more than anyone. She was a really good listener. Miss Greer helped me and my brother get involved in after-school activities like baseball and soccer. Our coaches were super nice and were mentors to us. Staying after school for practice kept us and a lot of other kids out of trouble. When schools help take responsibility for preventing ACEs, everybody wins. My life could have gone in a completely different direction. Studies show that ACEs can have long-term negative effects on kids' health and well-being that may last into adulthood and even continue in future generations. But by people and groups taking action, ACEs can be prevented. In fact, there are 5 known strategies that help stop ACEs before they even start. You can implement them in your own community, just like we did. How? By strengthening economic support for families, by changing social norms to support parents in positive parenting, by providing quality care and education early in life, by enhancing parenting skills to promote healthy child development, and by intervening to lessen harms and prevent future risk. So, now you know my story, and you've seen the prevention strategies in my community that helped me beat the odds. I had healthy relationships with my family and friends. I learned how to take care of myself and make good choices. And today, I'm a mentor to other kids who need some extra help so they don't become an ACEs statistic. Safe, stable, and nurturing relationships and environments are essential to prevent child abuse and neglect and to assure that all kids reach their full potential. Are you thinking what I'm thinking? Banana split? You got it.
Thank you, Mr. V.
All right. Thank you, Ms. Davis.
Thank you.
I hope we all enjoyed that little video intermission. Right now, I'm going to talk to you a little bit about preventing ACEs. So one of the best ways to address the experiences is to keep them from happening in the first place. As we saw in the video, what the Center for Disease Control suggests is the following: strengthening economic supports for families, promoting social norms that protect us from violence and adversity, ensuring a strong start for children, teaching skills, connecting our kids to caring adults and activities, and intervention to minimize immediate and long-term harm. So what we're doing right now is actually a form of prevention, and I'd like to thank you all for being here. With the knowledge that you gained today, you can help ensure a strong start for our kids, promote norms that protect us from violence, and even discuss coping skills with your kids so they can learn how to work through difficult emotions that might arise. And while prevention is vital, it's only a part of our big picture. If you or your child has experienced any of these ACEs or significant trauma, therapy and other mental health treatments are an option to help. The social worker at your campus is an excellent resource when it comes to mental health services. If you're ever curious about these services, feel free to ask them for more information. We have multiple mental health clinicians in our buildings, including social workers, our SMILE therapists, and Department of Behavioral Health clinicians who can also provide mental health services right at school. If you're a Medicaid plan holder, you can also call the DC Access Helpline at 1-888-793-4357 to get linked to outpatient mental health services. Or if you have private insurance and are looking for mental health services, you can call the mental health line on the back of your ID card to be referred to services, or utilize the Psychology Today website, which allows you to search for therapists based on which insurance plans they take. But now that we've talked about mental health, I want to take a couple minutes to address some of the myths surrounding mental health treatment and the stigma around mental health. So there are a couple things I would like you all to know. One of them is that mental health treatment is handled by highly educated people. Any therapist that you're referred to will have a minimum of a master's degree and will need to pass board examinations and multiple background checks before they're licensed to provide therapeutic treatment. All medications are prescribed by doctors, nurse practitioners, and physician's assistants who are also board certified and have passed multiple background checks. Mental health treatment is also varied. Treatment plans are individualized and written for specific clients. They can include a variety of services other than just therapy or medication management, such as community support, case management, and CBI, or community behavior intervention. Mental health care is also affordable. If you're a Medicaid client, all services are provided at no cost to you. And if you have private insurance, they'll likely include copays, but the Affordable Care Act mandated that all private insurers cover mental health treatment. So I also wanted to take this time to kind of talk about some of the myths surrounding therapy and mental health treatment in general. I want to talk about some things that mental health treatment is not. The first thing I always like to talk about is that mental health treatment isn't necessarily CPS or removing your kids or something like that. While mental health clinicians are mandated reporters who are required to report abuse or neglect, they're primarily there to just help the person who they are treating. Just because someone's job title is social worker, it doesn't necessarily mean they're speaking to you because there are suspicions that something is going wrong at home. Mental health treatment doesn't always necessarily mean medication either. While you can choose to consider medication as an option, you can also choose not to. For outpatient services, it's extremely rare for medication to be required. And if you have personal or religious reasons to not want to be prescribed any mental health medication, they will be respected under almost every circumstance. Another thing that mental health treatment is not is a sign that there's something wrong with you as a parent or something wrong with your child. Mental health problems affect everyone across all races, ethnicities, and socioeconomic backgrounds. Mental illness is just like any other illness, such as the flu or that other thing going on that I won't mention right now. Sometimes when your body gets sick, you have to do something about it to make it feel better. It's the same way with your brain and your nervous system. Sometimes they get sick and you need to find a way to help them out. Mental health treatment doesn't always mean hospitalization. Only very acute mental health problems require hospitalization, and hospitalization only occurs if an individual is a clear and present danger to themselves or others. I also wanted to mention that mental health clinicians are actually very diverse and come from a wide range of cultural and socioeconomic backgrounds. While people often think about mental health as being a snobby or overly academic field, that isn't actually the case. Particularly here in Washington, D.C., the city we all call home, there's a really good chance that there are mental health professionals who you feel like you can relate to. That being said, symptoms might not be severe enough to require treatment, or treatment might not be available right away, although in emergencies, it always is. If that's the case, there are many healthy coping skills that can assist you with processing and healing from trauma, and we encourage you to practice them. Some examples of these are having good nutrition, exercising frequently, using creative outlets such as drawing, making music, or other art forms. Journaling, this is a practice I really love to teach my kids, just picking up a pen and a pad of paper and writing about how you've been feeling for a couple minutes every day. You can also practice mindfulness. If you're curious about that, Ms. Davis is our resident mindfulness expert, so feel free to talk to her. Spending time with family and friends, and spirituality. All of these can be absolutely fantastic ways to heal and good first lines of defense. With that being said, if you need to speak with a professional, please speak with one and track one down. Your family member, friend, pastor, coach, or other figure might be a fantastic listener, but they aren't an adequate substitute for a licensed mental health professional if that is what's needed at the time. Also, good self-care practices like the coping skills we mentioned on the previous slide may work for a period of time, but become slightly less effective over time. And when this happens, it's important that we try other things. Otherwise, negative feelings may take over and make our life significantly more challenging. So I'm just going to give you all a quick summary of what we have learned today. ACEs stands for Adverse Childhood Experiences. A higher ACEs score or more adverse childhood experiences increase the likelihood of health, mental health, and behavioral difficulties. We can prevent ACEs through work in our community, such as increasing economic supports, promoting positive social norms that don't include violence, and teaching our kids appropriate skills. However, if trauma has already occurred, it's important that we find ways to address it and heal from it. This can include seeking therapy, including engaging in good self-care practices, and seeking support from friends and family in your community. But most of all, I want you all to remember that you are not alone. Help is always available if you need it. Your school has clinicians that will always be happy to assist you. And together, with the knowledge we have got today, we can prevent ACEs from happening and find ways to heal from the trauma that has already occurred. Thank you for your time and your attention. Now we're going to go ahead and open up the floor for some discussion, and I've included our contact information. If you have any questions about the presentation or feel as though something about the presentation has overwhelmed you a little bit and you just like to talk it out with someone.
Thank you so much, Mr. V and Ms. Davis, for this awesome content. I can tell that you are experts in your field because as I was taking notes for each slide, it seemed like you were already like reading my thought process with the next slide. Because I was like, oh, well, what if, you grow up with a history of viewing mental health as negative, right? And then you had your slide about this is what mental health isn't. It was awesome. So I love the breakdown about that because we serve primarily our Black community, and in the Black community, especially, mental health is viewed as something negative. Something may be wrong with you, or it may seem severe, like you may need to be in a mental hospital. But when you broke it down, like it's just like a common cold. It's just like, you have to take care of your body and you have to take care of your mind. And going through therapy is important because just like you need to take care of your body, you also need to take care of your mind. So I appreciate you for sharing that. Another thing that I love that you mentioned was that some self-care practices are great, but it's only temporary. And so I'm a big advocate of self-care. But like you shared, it's the mind, the body, and the soul. You have to take care of all of it in order to really thrive and to be healthy mentally and physically. And, your spirit has to be right. And so we oftentimes in the Black community will get together around like maybe a coffee or dinner or happy hour or something like that if we're an adult. And we talk to our friends, right, about different things that may be on our mind or even concerns that we may have had about our children. But the truth is, like, our friends, unless they are a professional, don't have the capacity to give you the healing that you may need as you would talking through a mental health. Is that correct?
Yes.
Yeah, exactly.
So it's good to to talk to someone and don't feel like there's something wrong with you or there's something wrong with your family, or, you know, there will be like this negative view of you or your success. You won't be successful. You know, don't think that, because ultimately it's about you being whole, your child being whole. If your child has gone through some type of trauma, and making sure that you are set up for success throughout your life. One thing I love about friendship is that we care about the whole person. It's not just academically, it's socially, it's personally, it's professionally, because we want to create world-class citizens.
Exactly.
World-class citizens. And so if you're going to be world-class, you have to make sure that your mind is right. But the statistics were amazing to me. So in your presentation, you put that 61% of adults experience at least one.
Yep. So over half of the people in this country
Yes.
have experienced at least one adverse childhood experience. And I really wanted to bring that up to try to normalize it. You know, like a lot of people have been through it. If you have, you know, it's not a negative reflection on you or anything like that. It's a pretty common experience. And it's evidence that we need to do a better job of addressing this stuff.
Exactly.
Right. Well, I mean, we could add COVID, right? COVID. I don't think COVID was added to the statistic.
Yeah.
Not at that time, but surely when they did their research back in 2000, I think in 14, Dr. Burke, she realized that it was something going on, you know, there in California, and like they're saying the children are having all these issues. And when they did the study that she did and the others, found out that, you know, it was something that it had something to do with their childhood. You know, an adult might still be going through something, and then next thing you know, they have a child and they enter school, and then they're having learning problems, or it's not even just learning disabilities, it might just be behavioral. And they just kept digging and digging, and they found out that, you know, it was some things going on that we need to address. And it's nothing wrong with talking to a therapist or talking to a school counselor, finding out how to get, you know, use resources to try to help, you know, because it's part of healing. You know, like you said, you know, when we get sick, our body gets sick, we go to the doctor, we want to feel better. And so, yes, adverse childhood experiences, you know, is real. And we can take ownership of it now and just say, okay, we know what it is. Let's, you know, embrace it and just move forward and try to help our families, help our children. So when they grow up, they'll understand, you know, things can be better.
And I always like to use the metaphor of a volcano with our kids when it comes to things that make them feel some type of way emotionally. And it applies to ACEs too. You know, you can keep pushing stuff down and pushing stuff down and pushing stuff down, but eventually it's going to come bursting out of you. And rather than letting it get to the point where it comes bursting out of you and like a volcano, you erupt, you can talk to someone about these things and work them out before they get to that point.
And then I also love the slide about what does trauma look like. And then one of the things that I wrote down, because this is Bullying Prevention Month, was bullying.
Yes.
You know, statistics have shown that most times that if you research a child who is a bully, that they're experiencing some type of childhood adverse experience. And I mean, if it's not addressed, it can cause harm, like you said, to another family and someone else and someone else. There's a popular quote that says, hurt people hurt people.
I was going to say that.
And so it's a continuous cycle, you know, if it's not addressed. And if you're just joining us, the other statistic that they said, if 61% didn't stand out to you enough, is that 1 out of 6 adults have experienced 4 or more.
4 or more.
4 or more.
4.
Exactly. It's a lot.
Wow. So the people on this Zoom or the people that's watching this presentation right now, 1 of 6 have experienced it. And now I'm completely transparent with my life. I've definitely experienced it. I was molested as a child. And I experienced, looking back, I experienced a lot of what trauma looked like. I isolated myself because I felt like I was the only one. I did not feel like anyone would believe me. And I had some anger problems. And I did journal, but that was just really because I didn't talk to anyone. And then finally, I shared my journal where I shared like my whole story to my mother. And it turned out that she was also molested. And so we go around and we share our story, which is why I don't mind sharing hers, because I know that she doesn't mind. But once we were able to, one, connect with each other to realize that we weren't alone in that, then we were both able to heal individually. And then we were also able to help other people heal, because then we were able to share our story. And it's the same thing, just like hurt people, heal people can heal other people too, and can inspire other people to heal. And so I love the slide. I just love the whole presentation, but I definitely put a star beside how we can help.
Yes.
And so one of the things that you can do, whether you're a parent, whether you're a business owner, whether you're an organization serving families, is mentorship. I put giving back or being a positive influence, like me and my mother, like how we share our story and we share our healing process. Just different workshops. So I love that we're doing these types of workshops where it's not just academics, because we understand that we go through different things, but if you are an expert, just like I took notes that you specialize in mindfulness, or I'm going to bring you back.
Davis is our mindfulness queen. She'll have a 5-minute mindfulness talk with you, and you will be zen like you have not felt zen in a long time.
Yes, a lot of us have problems shutting off our minds, even when we sleep. Like, it's always like, did I do this? Did I do that? Especially if you're a single parent, or I just feel like just being a female in general, it's just so much that you just have like a never ending checklist in your mind. And so even if it gets crossed off, it's something added to the list. So that mindfulness piece is so important, It
is. You'd be surprised with 5 minutes of your day, if you just think about how you could just sit in a chair quietly and listen to your breaths, just breathing and just taking it in and releasing. Those 3 to 5 minutes will help you so much. I had been on the phone with a parent, really going through it, because this virtual learning, and I was like, Mom, let's calm down for a minute, just take a few breaths. Before our conversation was over, she felt a whole lot better, because with mindfulness, you'd be surprised from the top of your head to the bottom of your feet. You can feel the relaxation. You can feel the comfort just for 3 to 5 minutes, listening to just calming music, or just not listening to anything. And you'd be surprised what you can hear around you, that's going on in the atmosphere. But we need that. We need that mindfulness, that moment to just take the time and reset and focus on what's going on inside of my body. I'm so tense. But those 3 to 5 minutes can bring you all the way back down to like reality. Like, it's all about me. Let me calm down. Let me feel.
10 and you just come down, right?
You just come down, yeah.
One of the first things they tell you to do is breathe.
And all you do is breathe. That's
when
it.
You're stressed out, it's funny how you have to remember to breathe, right? When you're stressed out, or when you're worked up, sometimes that breathing can become difficult.
So mindfulness can take you a lot of places.
You're coming back. Look, I'm already I'm telling you that you're coming back.
Thank you so much. I will be back.
So some other things was just different trainings that you can do, personal development workshops, some supportive programming And then one of the things that was mentioned in that video was like aftercare programs just to help so that, we understand that we serve our families and everything. But, creating different aftercare programs for the scholar, but then also programs for the parent to also be able to get the support, because like we said, it's 1 in 6 people. So most likely it may be the adult that also experienced the childhood adverse experience, but then the child too, and making sure that you pour into the child and pour into the adult simultaneously so that healing can take place.
And trauma that is not properly healed can get passed from generation to generation.
It's so true. It's so true. Because one of the things that I would do, my husband actually, he admired it about me, but I told him it's because I was molested and I had a poor childhood of not healing. But he admired the fact that he says I can cut off people really quickly. Like I can, if someone is just acting funny, then I can be like, okay, well, I'm really dismissive. And I'm like, no, I am learning to grow past that. Like I'm learning to be more forgiving and understanding and work things out and understand personalities. But I realized that because of my childhood experience, I pushed people away very quickly without, giving them a chance to even talk anything through or get understanding. So I'm like, please don't admire that about me. That is a weakness that I'm learning through. But it's definitely something to be aware of, and self-awareness, talking about how we can help. Self-awareness is key too. So one of my questions is, for a family member who may be going through adverse childhood experience, what advice can you give them to help heal without making them seem like they're being too overprotective?
I think you always start with listening. Making someone feel safe and giving them an environment wherein they feel comfortable sharing a little bit about what they're going through. I think being a good listener, and most of all, being patient, because someone might have gone through something and they might be willing to acknowledge it, but they might not necessarily want to talk to you about it right away. So definitely have some patience and give them time to come to you.
Yes, because it might take a few visits or a few conversations before someone will open up about something that might have, caused them some traumatic, in their life. And you want to give them that space. You want to let them know that they're in a safe place. You want them to be able to share and not be judged, and just let whatever they have to share, release it. And then as a therapist or counselor, we can help them work through those moments, because anything could flare it up, trigger, So we want to provide skills how to overcome those trigger moments, So, yeah.
I have a question. My question is more of a comment. Since the pandemic, all of our lives have been disrupted and it has been interrupted. How can parents who are dealing with that be able to have a better relationship with their children? What advice would you give a parent as their child is going into a distant learning space, in a hybrid learning space?
You want to answer that, Mr. V? You want to? Go ahead.
I think I would start with encouraging parents to remember to take time out for themselves. Because a lot of the times, working from home right now, parents might be working, their kids have to go to class, they got to put dinner on the table. There's a whole list of stuff that they're going through every day. I think first and foremost, our parents really need to remember to set time up to take care of themselves as well. And to take the time to process some of what we've all been going through, and take the time to do things that make you feel good and make you feel calm and make you feel grounded. Because if you're not taking good care of yourself, it's very, very difficult to take care of other people.
Yes.
And I say that, as a mental health professional, there have been, times earlier in my career when I was still kind of learning how to take great care of myself with all the stress that my work put me under. And, I realized pretty quickly that like when I'm not at 100%, I can't help the kids I work with as much as I would like to be able to. And I'm sure it's very much the same way with our parents.
Mm-hmm.
And it's of the utmost importance that they take time to process some of what's going on and
Mm-hmm.
take care of themselves and engage, in a self-care routine.
I totally agree, because I think last week when with the parents, I think it was our back to school night, and we did a little something for the parents on some self care, gave them some ideas, and some of the ideas that I think that would be, during this time, it's like Mr. V was saying, take care of yourself, find some, take a walk, do some exercises, change up your schedule a little bit, because right now it is overwhelming. Parents are being home or have to go out of the home, and they're leaving their children home, children at home to do this remote learning. And so, some of the parents are feeling overwhelmed. So we like, take the time and take care of yourself. Go out and do something fun. Play a funny movie. Talk about something fun in the family. Just bring out something, talk about things to take your mind off of what's really going on, because we're here, we're in this, and we all are trying to adjust, and we're trying to find ways to keep ourselves safe and take care of ourselves, so we can provide as much support as we can to the families and the students at the same time, and the teachers as well. So
Nellie, thank you so much, because I was going to ask Ms. Davis about adults as well, not just our parents, but just those who are the teachers, the leaders, and those who work in the administration. How, what your advice would be with regarding, I'll just say our staff.
mm-hmm.
What is your advice as counselors and leaders in this area? How we need to take care of ourselves during this time?
Yeah, well, we do our Wellness Wednesdays. Every Wednesday, we find a topic, and we just try to provide as much support as we can to our staff, and and hopefully that they're taking reading those articles, or whatever. If we post a video or something, that that they're taking some of that information and using it, because every day is different. Every week is going to be different until we return back in the brick and mortar, and we don't know what that's going to look like until we do decide to go back in. And so there might be something else that we might have a discussion about. We're going to have to uh, provide maybe additional information on how we can take care of ourselves, and what it's going to look like when we do return.
I
So
also
that.
think it's really important for us to focus on having a routine for ourselves and giving ourselves structure. Because when we're in the school building, we've got plenty of structure. We're all in early in the morning. All of
Mhm.
what we're doing throughout the day is pretty well scheduled, especially if we're a teacher or a dean or something like that. The kids get lunch at a certain time. You get out of the building generally around the same time every day. When we're in the brick and mortar setting, we have a ton of structure built into our day-to-day routines. But when we're working from home, a lot of that is it's a little looser. Our engagements are kind of scattered throughout the day. Some days maybe we have a ton to do. Some days we have maybe not so much to do. So I've found that it can be very, very helpful to just have a routine that we put together ourselves and engage in similar activities, over the course of the week, that are things that you consider good self-care. Like, I know people that are doing great take in a long walk at one specific time every day, or pick in a night during the week where they're cooking a big meal, or taking time, a certain time every day to go to the gym. I'm not even sure if gyms are fully back open yet, but exercise, or setting aside 15 minutes a day to call their parents and have a conversation with them. I think it's important that we find ways to give ourselves structure. during the distance learning period. So we had something to kind of fall back on, and we're not necessarily just kind of sitting around all the time, you know, getting stuck in our own heads.
There's this joke that circulates around social media about how people just felt like the biggest waste of money, or one of the biggest waste of money, was purchasing a planner for 2020 because all the plans just got canceled, right?
All of them.
But it's still important, like you said, to carve in time. I have a girlfriend who I went to go visit, and she just got caught up in that world, in that remote working world. And like she would find herself from sunrise to sunset, just sitting in front of a computer, hardly eating, you know, just focused on work. And so she was dedicated to carving out time. Like she'll have an alarm go off on her phone where she's like, all right, you need to get up and move. You need to go experience nature. You need to, you know, at least do some jumping jacks or something, you know, in that time that she created for herself. And I thought that that was a great idea, because sometimes I can get lost in that world. And sometimes I find myself looking up at the time and it's 2 o'clock in the afternoon. I'm like, oh my goodness, you know, I need to eat, you know, but we have to take care of ourselves, because we can't serve other people, especially, you know, in the education world. Can't serve other people if you're not first taking care of yourself.
I agree.
Do we have any more questions? Because we're a little bit over our time, but this is such a good conversation. We may need to do a part 2 with Ms. Davis coming back.
I'm available. You know, give me some more of that structure. Give me something to look at.
Right. So yes, if you're a friendship family, we have so many resources for you. The best way that you can get access to the resources is, if you haven't taken notes about where you can get the resources, is just through we care at friendshipschools.org. That's our hotline email. Or you can call our hotline phone number, 202-281-1777, and we'll definitely connect you to the plethora of resources that we have to support our families. And then, you know, if you're a prospective family, you know, please check out our website at friendshipschools.org. We have free resources on our website as well for COVID-19, wellness resources, just different learning resources during this time of virtual learning. And you can always just follow us on our social media pages. Thank you so much, Mr. V and Ms. Davis. I love this presentation. Love chatting with you.
Thank you for having us.
Thank you for having us. It was fantastic to be here.
Yes. We'll be adding this to our YouTube page, so this will be available for replay. So please continue to share this through your social media platforms, and through anyone who you feel like can benefit from this, because, you know, someone you know, or yourself may have been affected by this. This is definitely helpful information. All right, well, until next time, next week we will be talking about bullying. We're in the month talking about bullying, both sides of bullying. So I hope that you can join us. We'll be right here on Facebook Live and on Zoom next Wednesday, October the 28th at 5 p.m. I will see you then. Take care.
Take care.
Take care, friendship family.
Take care, friendship family.